Hi everyone, Sarah Strackhouse here with Real News Communications Network, and I have a very special guest for this week's Live with Dr. J. We have Elizabeth Atchason. I hope I'm saying that correctly.
You're saying it right, yes.
How are you?
I'm doing well.
Good,
Thank you.
Good. So you're a nurse practitioner here at Johnson Medical Associates. Can you tell me a little bit about what you do here and how kind of your journey here?
Yeah. So I started back in October, and I'm working part-time right now, and maybe increasing hours, and I'm helping with all sorts of patients. I'm kind of taking over more of the hormone, bioidentical hormone, women's health division of Johnson Associates, and helping Dr. Johnson out with that because I have a very strong women's health background.
Right.
But I also help him with his general medicine patients. I'm a family nurse practitioner, so family practice is my background as well. And I'm helping him with his allergy patients, his mold toxicity patients. So I do a little bit of everything around here.
Yeah, you kind of got your hand in everything.
Yeah.
That's wonderful, and especially to have that women health aspect as well. So you kind of said a word in there, bioidentical hormone replacement,
Yes.
right?
Yes.
Can you tell me, what does that mean? It feels like a mouthful.
Well, there are women, younger women and menopausal women that deal with hormone issues. So basically their bodies they produce too much hormone or too little hormone, and there are multiple female hormones involved. And if we identify that there's a problem and that it's causing them to feel bad, not sleep well, severe mood swings, changes with their period, there's lots of different symptoms that go along with it, then we can supplement or give them vitamins to help decrease the hormone levels, to balance them, to make them feel better.
Wow. So what does that look like? Is it different for every person, or is it kind of a trend that you see that people who are experiencing these problems all come to you with some of the same questions?
Yeah. Well, it's both. I mean, if you're looking at a woman in her 20s or 30s, premenopausal, or in the middle of menopause, 40s to 50, or postmenopausal, 50 to 60, you have similar trends, but everybody is individual. You will get patients that don't fit what you would think their levels would look like at that certain age. So it is very individual as well.
So I always think about, when I hear the word hormone or hormonal or something like that, I always think of, the hormonal teenager, or, something like that. Does that play into, is this along this similar realm of, the same subject, or is that completely different?
Well, it is, because when we go through puberty and our female organs develop, we start producing female hormones at different levels than we did before we went through puberty, and that starts our menstrual cycle. So the hormonal teenager is just our body trying to figure that out and establish a pattern with our menstrual cycle. Right. And there are a number of years, it's different for everybody, where there's a lot of fluctuations. Sure. And then as we get into our 20s and later, there should be a little bit more of a pattern, though it still can change with time, with age, and lots of different factors. And so, usually when they're younger, we kind of let it work itself out. We don't tamper too much and test too much their hormone levels, because we know it's just going to keep changing. And then when they get older, if they start having issues, that's when we start looking for, treating a hormone imbalance.
Sure. And you said before, when you said supplements, or what does treatment look like? And I guess, is there a test that you go through to find out, if you do have an imbalance?
Yes, there is. There is testing. Now, some traditional ways were the birth control pill, and for postmenopause, there were certain types of hormones they would just give women. Oh, you don't have a period, you have hot flashes, here's your hormone. But the more individual way is to actually test the hormone levels through blood testing, blood spot testing, saliva testing, and actually see what those hormones look like, those levels look like. And sometimes we have to do it over a period of time too, a couple months, to see what their pattern is, and then identify if we need to give them a supplement or give them hormones to increase their levels and balance them.
So if you've never had issues with it, and is it something you can grow into, or if you have had issues with it, and is it something you can grow out of?
Yeah, you can get it at any time of your life. So there'll be some women that will have estrogen dominance, and then, you know, they may lose weight, or there may be some life changes, or they go through menopause, and then you don't have too much estrogen anymore. And then also surgeries. Some women will have they'll get a tubal ligation so that they can't get pregnant. They'll have a C-section. They'll have a hysterectomy, and those kind of things then will change your hormone levels, your production of hormone, and then those are more permanent changes.
I can imagine. Are there any questions that you really get a lot, or any misconceptions that when you talk about it, you know, some people just a light bulb comes on or something like that?
Well, when you talk about hormone imbalance, especially with menopause, a lot of women think, well, before menopause, they think, okay, birth control. I have a problem. I just need to take a birth control pill.
Right.
And that can work, but that doesn't always address the issues the best way. And then after menopause, a lot of women think estrogen. They just need estrogen.
Right.
But there's estrogen.
A lot of soybeans, right?
Soybeans, yeah. But there's estrogen for hot flashes, but there's also progesterone. Some women have too much estrogen. There's testosterone, DHEA, and so those imbalances can cause a range of different types of symptoms, and finding out what the imbalance is and correcting it will help the patient out the best way.
So I don't know if this is something that's well known and I just don't know it, but those, you know, all the hormones that you listed, are those the main ones? Are there lots of different hormones? I mean, what does that really look like?
Well, there's a whole cascade.
Okay.
And then there's lots and lots of different hormones. They
Right.
start with some precursor hormones, and they convert into some other hormones. Some of the hormones are directly produced by the organs, like the adrenal gland. You've got DHEA. You've got some testosterone that comes out of the DHEA. Cortisol. You've got the thyroid gland that produces the thyroid hormones, and then the primary producer of the female hormones, the estrogen and progesterone and testosterone, are the ovaries.
I see. Okay. Wow. So
it's very complicated.
I was going to say
it is very complicated.
Yeah. But it's interesting because I think it's something that, you know, you might realize you're having an issue, but you might have no idea that it kind of has this whole root, you know, of why it's happening.
Yes.
Is that something you see a lot?
Yes. I'll see women come in for a totally different issue.
Yeah.
Or, you know, their periods are just irregular, and they don't expect to maybe need to look at some of the other different hormones and see if that's causing their problems with their periods.
Right.
Yeah.
So some of these, the problems that you're talking about, are they more severe, or can it be little things that you just notice that just seem a little bit off? You know, what should people really be looking out for if they're watching and they're like, well, I have no idea if I have a hormonal imbalance?
Well, both. I mean, really, really heavy periods that bother you. You know, that really, really bother you and affect your life. Really painful periods. So some are more minor. Some people have minor weight gain. Some people have minor sleep issues. A lot of times they notice a change. So they were going along fine, and then boom. Why am I waking up in the middle of the night and my whole bed is wet with sweat? The hot flashes in the middle of the night, and that can come at a young age. I mean, you could be 35 and that is happening.
Right.
And so some people know the subtle, milder. Other people are more severe, where like with the mood swings, they'll notice that at the end of the month, they're having severe depression or severe anxiety. Or they stopped having periods, and now all of a sudden they're having severe mood changes.
Wow, that's interesting. You know, I wouldn't even think that some of those things would go along with, obviously, the hormone changes. Yeah. Are there any really questions that I haven't covered that you get asked a lot?
One thing is, what's the difference between the treatment, between just taking a birth control pill, taking something like just estrogen patch or Premarin after menopause versus the bioidenticals. And the difference is with the bioidenticals, you're generally testing to see where the levels are. You're looking at multiple hormones, like I talked about earlier. And then what we want to do is we want to prescribe something that's natural to the body, that is the same as what their body used to make. So if it's an estrogen, it looks like the different estrogens that the body makes chemically. Progesterone, testosterone, the same, versus an artificial prescription hormone that, like Premarin, that has a different chemical makeup, or medroxyprogesterone that has a different chemical makeup than natural progesterone.
Wow.
Yeah.
Okay. And so sometimes is it you have to take some and you kind of have to see what works, or usually is it you can kind of people usually nail it the first time.
Both. So
Yeah.
sometimes you nail it the first time just based on experience and
Right,
treating a lot of
right.
patients, and other times you just don't know how the body's going to take in the hormone, how it's going to break it down and use it, because some are oral, some are topical creams, some are
interesting.
vaginal suppositories, and so sometimes then you have to tinker with the doses. But with the bioidentical hormones, the compounded, I feel like it's really easy to go up and down in the dose and get it individualized for that patient and get it right.
What does bioidentical mean? What is a bioidentical compound versus, something like a birth control or something like that?
Yeah, so it goes back to the hormone makeup. A birth control pill that has an artificial estrogen and an artificial progesterone in it is going to be partially chemically similar to that hormone and then a little different. Whereas a bioidentical hormone is that it's biologically identical to the hormones we make.
Wow.
So you give estradiol and they look the same chemically. So they work very similarly or the same chemically in your body.
Is there one that you recommend over another, where the natural versus artificial, or does it really just depend each person?
I recommend to all my patients that the natural is better because just like thyroid hormone, if you have low thyroid and you give them like a Synthroid, you want it to look the same and work the same as the thyroid hormone that should be there. And it's the same with the female hormones. You produce estrogen, progesterone. It's going to work the best if it looks the same and acts the same. The artificial hormones, when they're broken down in the body and the liver, they can be created. There's chemicals that get produced that can cause some problems. Because they don't chemically work exactly the same, there's some more side effects and more risks to taking them. Mm-hmm.
Wow, that's interesting. I feel like there's so many more questions I want to ask, but is there anything else that you really think I haven't asked you that you get a lot?
I guess one thing is if you start to have hormone issues, before you reach menopause, is getting in and getting checked out. I mean, even if you're in your 20s and 30s, if you think it might be a problem, it's easy to do a blood test or a saliva test and see where it's at. I have a lot of women that don't think about coming to me until it's very severe, and then it takes a little longer to get things leveled out, whereas the women that come early, way before they've started menopause even, they get balanced, and it's just either an easier balance when they're younger or easier transition through menopause.
Right. What if someone's thinking they might have some of those issues, but they're a little nervous to come see you because they don't want to, be dramatic or make it more than what it might be? Is it okay to still come just kind of get a checkout?
Oh, yes, because you can always come and get the blood test, and you can always... I really work with my patients, so I give them lots of different options that works with their insurance, but that works with their bodies, with what they're comfortable with. But I don't, nobody should be pushed into you have to take this. Right. So they can definitely just get checked out, see what it looks like, and then think about it and make that decision based on what their labs show.
Perfect. That's wonderful. Well, if people have any questions, let me just double check that I haven't missed anything here. So if people have any questions, should they contact Johnson Medical Associates, directly here and ask for you, or what's the best way to do it? Yeah,
they can contact us and ask for me. They can make an appointment. Okay. Or we have our Facebook page, so you can put some generalized questions on there.
Yeah. Awesome. All right. Well, we'll make sure. Of course, we did tag above here, so you can tell exactly what to click, the Facebook page to click, so that you can get any more questions, and feel free to comment under here. We of course will be always watching. So Elizabeth, thank you so much for joining us.
Thank you. This was great. Thank you very much.
Thank you. All right. We'll see you later.